We are continuing the Immune Q ESP Technician Telemed Practice course. And today a very, very important lesson on blood pressure, because this is the #1 killer of people, cardiovascular problems. It is okay to tell the patient to get a home blood pressure monitor and teach them how to use it. It's very important because it will help you, especially if they are at risk. How do you know that they're at risk? Well, here's the causes. If we look at all the causes of blood pressure, study on this, and we're going to see that #1, carotid sinus, carotid body problems can be a cause of blood pressure. Now let's talk about that today very, very thoroughly. Today we're going to go over the carotid sinus, carotid body, and its effects on blood pressure, migraines, and a host of other different ailments. We're going to be teaching you a technique to help to balance blood pressure, get out of the migraine, etc. But first we have to go over what is the carotid sinus, the carotid body, and just what is going on here. This is the part of the body that is designed to detect oxygen, carbon dioxide levels in the body. Also to judge barometric pressure outside as the pressure changes, when a storm comes in, etc. You hear certain people say that that aggravates their condition. That's because there's an involvement with the carotid sinus and the carotid body. Now we're going to learn about how to tap on this spot and activate it. This is something that we've been doing for a long time, and it's very, very powerful, but we have to be very cautious. You see, this carotid sinus stimulates the baroreceptors reflexes of the vagus nerve. Now the carotid sinus are involved in the barometric atmospheric pressure, and the carotid body measures the oxygen CO2, mostly CO2 content. And this is how it's able to help balance the body. It's a very, very profound effect. It's attached to the vagus nerve. These two spots are here in the neck. And we're going to teach you now how to palpate it and how to listen.
Assess the carotid pulse. Again, go ahead and look straight for me, Makana. You want to avoid checking up in the higher aspect of the neck where the carotid sinus is. If you massage the carotid sinus, it can cause a reflexive drop in blood pressure and heart rate. So you want to avoid the upper half of the neck and instead feel for the carotid in the lower half of the neck.
When the blood pressure and the heart rate are too high, too fast, then we want to do the carotid sinus massage to bring the pressure or the heart rate down. But if the heart rate and the blood pressure are normal, we do not want to massage this area.
Next, I'm going to use my stethoscope and listen over the carotid artery for bruits. This is important to do in someone who is middle-aged or older, anybody that you suspect to have cerebral vascular disease, and if you felt a thrill. So part of your assessment when you're palpating is to feel for thrills, which is a cat-like purring. So you'll feel that sort of cat purring or that vibration. And if you felt that, then you would need to assess for bruits.
A thrill is like a hummingbird or a cat purring sound, a vibration that comes from that spot there on the carotid artery. This will tell us that that patient is some type of risk of aortic stenosis or some type of blockage in the artery.
I'm going to listen with both the bell and the diaphragm of my stethoscope. And again, you would listen to both sides, not just one. I'm going to listen to just his right side for now.
If there's calcification buildup or some type of blockage, then this thrill, this bruit, will produce a distinctive sound. And this will tell us that we really don't want to do any type of heavy massage on this carotid sinus. We don't want to break up and cause a stroke. Now here's what that sound will sound like in the stethoscope.
Next, use the bell of the stethoscope to auscultate for a bruit on both sides of the neck. A bruit is a whooshing, murmur-like sound that suggests arterial narrowing. If present, it would sound like this.
Know that if someone has an aortic murmur that radiates, a lot of times aortic murmurs will radiate up to the neck, so you may mistake what you think is a bruit, but it's actually a cardiac murmur. So make sure you listen well over the cardiac structures to see if there's a murmur there that's just radiating up to the neck.
Now, I published this sign on the carotid sinus tap about 45 years ago in a medical journal that I published. So we've been doing this for a long time, very safely, very easily. If there's a bruit or a thrill, we don't want to do this. But now let's look at a patient who has a tachycardia.
The normal heart rate is anywhere between 60 and if you're active, maybe 100. His heart rate went suddenly to 170.
Doctors at Mercy Fitzgerald needed to act quickly. A racing heart can be the result of many things, including anxiety, stress, medications, and heart disease.
In an older patient who's had heart disease or a weak heart, they could collapse, they could have a heart attack, they could lose their blood pressure.
But Mr. Jackson wasn't given a shot or even asked to take any medicine right away.
By the time you get the medication out, it may have gone into cardiac collapse.
Instead, ER Dr. Jim Roberts leaned over and did something that surprised the retired accountant.
I think it's amazing.
The doctor pressed and gently massaged Mr. Jackson's carotid artery.
That sends a message to the heart to slow down by releasing some chemicals at the vagus nerve, and it stops the rhythm like that. And I just did that, and in about that length of time, I look up and his heart was back to normal.
Dr. Roberts literally wrote the book on emergency medicine and says the procedure has been around for years, but doctors must check for clots that could rupture and lead to stroke before doing the massage.
I've had patients that are taught to do it at home when their medications don't work. Have a cardiologist check you out, and if everything's okay, you ought to be home tomorrow.
I'm very thankful and very grateful for it, too.
So instead of a massage, I developed a little technique called the tap, carotid sinus tap. Somebody called it the $1 million tap because it helps to restore proper balanced blood flow to the brain. It helps to restore oxygen contact. It stimulates the vagus nerve. It helps to bring that balance back to the body. Now, it's very, very simple to be able to do this. You reach up with your fingers, and you'll find on both sides, equal to the top of the trachea, up there where the Adam's apple was on a man and a woman has the trachea, above the thyroid. You trace back until you find the two spots that are where the blood is going through in the carotid sinus. Now, as you take back with your fingers, I recommend to use these two fingers, and gently pull back until you find the two spots where the blood is flowing. And then sense whether the blood is flowing too much on one side or the other. Gently push, don't push too hard, you don't want to take blood away from the brain. Very gently. Now tap 10 times lightly on the weak side, blood flow, then 10 times on both. You can do this twice, but no more. Once a day, no more. This will help get out of a headache or to lower blood pressure.
This video is going to introduce you to carotid sinus massage, or vagal massage, or the vagal maneuver. It has a lot of different names, but its main goal is to diagnose and or treat supraventricular tachycardias or AFib or other hypersympathetic excitatory patterns in the heart. This is something that you can do at home. This is something that anybody really can do. It's safe, and I'm going to teach you how to do it the right way and the effective way. So just a little bit of anatomy here before we get started. The vagus nerve, also known as cranial nerve 10, runs up the neck and into the cranium just lateral to our carotid artery. And the carotid artery is the big one. This is the one that supplies the whole head with blood. This is why it's called the carotid sinus massage, is because the area that you're going to be massaging or palpating is just lateral to that carotid sinus, the carotid artery. So what you're going to want to do is take your hand and feel on the side of your neck until you feel your carotid pulse. And you're really going to try and localize that as best as possible. So take your time, make sure you're in the right part here, and then you want to move just lateral to that, and you'll feel some tissue, and that's what you're going to be feeling for. And you're going to work your way up and down that tissue, just lateral with your pulse, and if you ever lose it, just find it again. Massaging and palpating, pushing in. You're going to want to do 3 or 5 seconds, and then move your way up and down the side of your neck there. You can do it on both sides. I would recommend doing it on one side and then the other. And the reason why is because if you are too medial and you're on that carotid artery and you occlude, or mean you push down too hard on that carotid artery, you're effectively turning off the circulation or the blood supply to your head. And if you do both sides at once, it can be really bad. That can cause you to have what's called syncope or faint, and you lose consciousness. I'm going to have my patient step in here. So let's say that my patient here is experiencing atrial fibrillation, or AFib as it's commonly called, or he has a supraventricular tachycardia, a SVT rhythm. What I'm going to do to this patient is this patient's typically going to be in a hospital bed, probably coming in and out of consciousness, maybe even out of consciousness totally. I'm going to feel on the side of his neck for that carotid pulse. And I got it right here on this middle finger. I'm going to move just lateral to that, and I'm going to palpate on one side, up and down. The idea here is that your vagus nerve conveys all of the parasympathetic nerves, a lot of parasympathetic nerve activity down to the pericardium, to the heart. And so what you're trying to do is you're trying to instill a hyperparasympathetic state, which would then cause your heart to relax, to chill out, and not be in fibrillation or in tachycardia.
This technique is a very, very good technique to help awaken the body, get somebody out of the vasovagal distress, to help wake up the body, get somebody out of too much sympathetic innervation, and it really does help to balance the brain, restoring oxygen flow and balance, and helping to reduce stress by stimulating the parasympathetic nerves through the vagus system. It's a very, very powerful system, and it can be done safely. Do a little tap. Make sure you get the patient's not a major stroke risk. Make sure that you've at least palpated for thrill. Listen for bruit. If you in any way suspect. Now, if you do find that there's clogging in the arteries, then there's a number of things you can do. We've created a number of videos, but I'll share just a couple of little tips with you here that would help. And one is to make this type of a juice, where you're going to get lemons, garlic, crush them up, add cinnamon, cayenne to taste, put this into a pot, a little bit of honey or other non-sugar sweetener, blend this in a big pot with 1 gallon of water. Low heat, simmer, do not boil. Then strain, store in refrigerator. Drink 8 ounces a day. That will clean up the arteries. So here's another good formula using water, lemon juice, apple cider vinegar, curcumin, cayenne, ginger, black pepper to help stimulate absorption. Take this once a morning on an empty stomach. Make sure you get lots of fiber, good healthy fiber to help clean out those arteries. Make sure that you get some good fiber foods, but this is a little extra fiber that will also help to sweep out extra cholesterol and other crap out of the arteries, getting rid of the clogs, etc. Make sure you use the beet juice, help to lower blood pressure. That's also good. It helps to clear out nitrous oxide, so that it helps make you more powerful. Only Nature Knows makes a formula I developed to help break up calcification. That's why we call it bone spur powder. But the supply of potassium and magnesium this gives lowers your blood pressure. Very, very important. It breaks up artery collection and also lowers your blood pressure. This is an emergency formula that can be used at the first sign of a heart attack or possibly even a stroke. And also always keep in mind what to not eat and all the different other things that can aggravate different problems. Keep in mind that the carotid sinus and the carotid body, sometimes just this area can dysfunction, and this can be the cause of your high blood pressure. That simple sinus tap will cure that. So use this wisely, and try to remember that only nature knows. The carotid sinus massage will take down the blood pressure. It will work. But there are many other causes of blood pressure that you have to deal with, and really helping to get to the patient. And most of them are diet, most of them are lifestyle, but you can help people with their blood pressure. Desiree Duvenet signing off.